Good morning, everyone. I hope you are having a good Friday morning so far. I am here at Glen Oaks Country Club in West Des Moines. We have a NAFA meeting starting at 9 o'clock, and I told them that I had a conference call to deliver first, and then I will join them. So I'm on my speakerphone and my laptop in a conference room at Glen Oaks. So I hope this goes off all right this morning, and we'll go ahead and move through our presentation here. Got a couple of things on the agenda. And by the way, if you think of other things that we need to have on our agenda that I'm not thinking of, please shoot me an email. But I try to combine a lot of the healthcare reform updates, but then some other things that may impact healthcare reform. And I've decided to add, as you'll see on the last agenda item there, a sales tip. I'll try to incorporate that every month as well, because I think there's so many things, and we all know so much of this. So it's not like you're going to necessarily go, oh, gee, I never thought of that, but sometimes just a reminder of some things to bring us back to some of the basics, especially as we look to ramping up your agency and meeting with more folks. So the agenda that I have today, we'll discuss a KHI partnership with ADP. Now, for those of you that have already attended the Wellmark, KHI Wellmark training, got a piece of this. I just want to touch on it and keep you thinking about it. So we'll touch on that. We're going to talk about SHOP again just a little bit. We're then going to talk about the Iowa Employer Benefit Study, and then fall training and sales tip, and then open to any other suggestions. I have to tell you, this was a slow week for healthcare reform in terms of, slow month, I should say, for healthcare reform in terms of updates. So we'll go ahead and go through here anyways. I think it's still some good stuff. So to me, especially as it relates to the Affordable Care Act, how do we keep our clients compliant? And it's kind of a mouthful, but I think once I had a meeting with ADP, and we visited about their ability to keep your clients compliant. That really spoke to me, because I felt like we didn't have another solution to offer you. I certainly know we're not going to keep the client compliant. You may or may not, but if you want to do that, you're probably going to have to purchase additional E&O insurance, is my guess, and or assign somebody specifically to compliance within your agency, and most of us aren't in a position to do that. But I was really excited about ADP, because as we know, they're a tried and true player in the payroll space and in the HR and human capital space. And who better than to go to that has systems in place, and they've got a great platform. And some of the things that they'll be able to do for you and your clients is help with those look-back periods. And if you recall, there's really two ways we use two different types of look-backs. And one is, do I pay or play? How many full-time equivalents do I have? Am I at 50 and above? So I have to offer a coverage or pay a penalty. So that whole thing about counting employees and knowing where you're at in terms of the employer shared responsibility. And the other way you have to look back, let's assume, oh, look, I know I'm over 50, but the other piece is, am I offering coverage to the right people? And you've got to make sure, the clients have to make sure that it's obviously all full-time employees working 30 hours a week or more, and there's so much more to that. And they are experts in all this, because they have been collecting payroll and processing payroll for years and years and years. And so a client may not have any kind of I'll call it an electronic payroll system today, or they may not have anybody else that's helping them with payroll. It might all be internal, because as we know, the other things that ADP does and some clients do on their own is collect time, process payroll. But what ADP will do is what we call look for outliers. So they're going to look for those employees that are getting very close. If they're, let's say they're supposed to be part-time and they're supposed to work fewer than 30 hours a week, but maybe on average they're starting to average 31 or 34 or 32 or whatever. The payroll system can flag that. And so there's some great things that they can do. Likewise, just make sure that the client stays compliant with who they're offering their coverage to and when, making sure they're meeting that no longer than 90-day new hire waiting period. If they're using a probationary time period, it's calculating all of that for the client to make sure, because the fines are big. if a client with an employer group was supposed to offer coverage to their employee and they did not, there's significant fines in that. The other thing is, you guys know the affordability determination is going up in 2015. And this system also keeps track to make sure that their plan is affordable. It meets that testing of cannot exceed, each employee should not pay more than 9.56% going up to that in 2015 of their adjusted gross income. And then, of course, they'll complete the IRS forms that are required. And the other exciting thing is there's a revenue share opportunity with agents. So we have a general agency arrangement with them so that we can continue to promote this partnership in support of you and your clients, and there'll be a little revenue stream in it for you. Now, it's not huge, but it's something for you to, I think, show. It's not only helping your client, but then there's a little reward in there for the time and trouble. So the other really exciting thing that I think is that once we show that we are interested in bringing them in to help our clients, then they're interested in helping us by sharing other opportunities. Maybe they have payroll, but they're not, the health insurance is not with a KHI agent. And they want, obviously we want to find agents in the communities where ADP is already there. So huge win-win, we think, for both of us. Actually, it's a win-win-win-win, right? 4 ways. It's for you, it's for me, it's for them, and it's for your client. And another angle, if you don't like the let's keep you compliant, if that doesn't resonate with your employer group, then how about the complementary payroll audit, where I love what ADP coins the phrase profit leaks, where they're going to look for any kind of leakage, any kind of, when they look through processes and find out, well, we've got, this is how we collect payroll, and this is how we process payroll. They don't actually bring a team out on site. They do heavy over the telephone and interviewing and understanding what the client's doing, and it's completely complementary. And obviously, it's so that they can uncover these issues and try to find the ROI in bringing on, because yes, there is a charge for this. It's a per employee per month. And so to get the whole package, I'm just going to give you a rough idea. Now, don't hold me to this, but I'm going to, I talked to Paul about this yesterday. It's probably in the, I'm going to say $10 to $12 per member per month to get all of these services. So it depends. There might be just a real sweet spot for groups that are at a certain size where this really, really makes sense. And of course, when you get so big, then the numbers are, if you're over 100, then they have a different model. But I'm kind of quoting you just an estimate for that size that typically we're going to say, a small group up to 100. But we can get to more detail. So I just wanted to make sure and try to give you a little more meat here in terms of how you can approach your clients about at least let ADP come in and do a complimentary payroll audit and systems audit to see how they're doing and is there any opportunity for improvement. And it doesn't cost a thing. So if you are interested, you think a client might be interested, please contact one of our staff. ADP does have several different reps that cover the state of Iowa, and we want to get you aligned with that rep. They do not sell health insurance. I heard somebody mention that to me the other day and said we're in competition with them. That is not true. The team that we're working with is excited about working with a general agency like KHI and our agents out in the field. So and at this time, I'm not aware that they have any other general agency arrangement with anyone else in the state of Iowa. So this is an opportunity for us to really get out there in this partnership and really help our clients and grow our agency revenues. So that's that. And as you can tell, we're really, really excited about this. If you have any other questions, like I said, get a hold of me or one of our staff. So SHOP. So here again, and maybe you're going to see there's a little sales bent to all of my slides this week. But the SHOP, I think, is sometimes overlooked. If you are in the small group space, or if you're not, and you're considering, maybe I should. I know a couple business owners in town, and the question, obviously, and we'll get to this towards the end when we look at agent of record changes as another sales tip, but in the shop marketplace, remember, this year in 2014, and as far as I know, in 2015, Co-Opportunity is the only health plan in the Iowa shop. If you hear differently, let me know, but I haven't heard of any other carriers. So that's true right now in 14, and as far as I know, that's true in 15. We're coming up on the time period here where it has to be announced who's in and who's out, and I think we know pretty much for sure that in the individual exchange, it's Co-Opportunity in Coventry, and in the shop exchange, it's still just Co-Opportunity Health. Now, as you guys know, you can purchase Co-Opportunity Health inside or outside the exchange. And if you're buying it inside of the exchange, all that really means is, because again, it's the same inside and outside, but all it really means is you're going to try to help your clients. You'll get online and show them how they can do it, but try to secure a tax credit for them. And so I just want to make sure that you know how to do that. And the way that we're doing it today, because the shop is not technologically set up to do what it is intended to do, meaning it's supposed to have all these carriers on there with all these plans, and when an employer enrolls in the shop, and they're from 1 to 50 this year and in 2015, and as you know, it's going up to 100 in 2016. Now it can be, it's based on the state and what the state decides to do, but my thought is that we will in Iowa go up to 100 in our exchange, in the shop exchange. But what they do is get online then and determine if they qualify. So because the technology is not there yet, the only choice they have is one carrier. If the employer in the future, the goal is, right, to have multiple carriers and have that employer, as I was saying, log on, sign on, and then their employees can select any carrier, any plan on the shop exchange that the employer has signed up for. Well, that technology isn't here. They're telling us it might be available November 15th, or they're saying it is, and I'm saying might be, so I'm not holding my breath. But in the meantime, so this is an opportunity right now to be talking to small groups and to ask them if, of course, they are interested in trying to see if they can get a tax credit if they offer benefits. So you go to healthcare.gov, you print and secure the official eligibility determination, and that's right there. It'll walk you right through it. It's not intended for us to do for them. They really are supposed to do it themselves, but I did have an agent that sat down with the group, and actually I was there and we helped do it together. So they need this help, and that's what we're here to do. So then you simply go to, now on the broker side, you go to Co-Opportunity Health and generate a quote. So log in, get a quote generated, enroll the group, enroll the employees, and now all that's left to do is take that official eligibility determination that they printed from the website. Early on, the HHS was mailing it to groups because they couldn't do the determination online, but right now it should say right away when they get done entering their information. And remember, we've talked about in past webinars that the qualifications are you have to have fewer than 25 or fewer employees. On average, they have to make less than $50,000 a year average. And remember, in that count, they also pull out owners and other family members of owners of a company. So there's a certain way that you count that. And then the employer group needs to at least provide or pay 50% of the premium. And so then if all that works out and you get your official eligibility determination, then you take that form to your tax preparer the following year and you will get 50% tax credit of what you contributed. So you can really look at it and say, it won't be free, of course, if you're paying 50%. It'd be 50, if you're paying all of it, then of course you're going to get your 50%. But it would be 50% then of what you paid is a credit that you could get back. So, so I say don't wait any longer, and let's keep in tune, and I will as well keep you guys posted on the status of the shop, and will they be offering this kind of technology that we've been waiting for in 2015. But I look at it and say, what point is that when it's Co-Opportunity? I don't mind doing it this way. This is just as easy. And we don't have to get online and do anything on the government website. So I like how it's working now. So take advantage of it. And then don't forget, you lock them in now. They're locked in then all the way through 2015. So if they buy a new Affordable Care Act plan now, then you've got that off your plate. You don't need to worry about them around the 12/1/11 renewals, which I know are all coming out right now, and a lot that are working in the group space are working feverishly on those. Okay, so So I was contacted. David Lind and I had a conversation. I highly respect his work. I think he is highly respected in our community. And so I talked to him about how can I provide more benefit for those agents that run their Wellmark and Co-Opportunity Health through KHI. We know that you have a choice, but I am interested in building benefits for those agents that bring both of those carriers through our shop. And so the benefit that we have put together is that for those cases that are, and I'm starting here, and of course if you have a special request, you call me, but for all those groups that are renewing that are going to be over 50 full-time equivalents, that's with Wellmark or Co-Opportunity, or that you run those through us. Maybe you're with another carrier today, it might be UHC or Coventry, but if you're looking at a Wellmark or Co-Opportunity quote, and you would like a benchmark study for each group, so the way you do it is you don't make copies of this thing. This is about our integrity, and this is about protecting what David has invested so much in this study. So the retail value of each one of these studies is over $300. But what we've done in working with David is we will purchase more of these studies. So it would be one study for each case that you think it would be helpful. And you know your cases. I mean, you know which client would like to see that benchmark report and pore over that thing. It's not everybody, and so let's not do it if you don't think it's going to help you and your client is not going to be impressed by this study. But what we're looking at doing is putting, obviously KHI's name will be inside of it, but co-logoing your name or your logo if you have one, or just your business name, with KHI's on the inside cover of the study. And then what would happen is, and we're still working through the details on this, that at David's shop, they would put then the client's name would appear on the bottom of each of the studies. And this helps to prevent copying these things and handing them out to everybody. So this is the right way to do it, and we will provide this for you complimentary as a way to say thank you for bringing your Wellmark and Co-Opportunity business through KHI. And we're really excited about this. So the 2014 study is just available now. So we're really happy about that as well, because we had been working obviously on the 2013 study up until this point. So give Nakia a holler if you have some cases that you just got, the renewals are delivered, and you really are looking to provide that additional value. Let her know, because this just might be the thing that helps you. By the way, just as a little, you probably saw the announcement if you're on David's email list, but the average increase that we're seeing employers are reporting is 6.8% increase. Now, isn't it interesting, because we just are seeing our renewals for 2015, and I've heard some of you say they're from -20 to almost plus 60. I think I might have even heard somebody had even higher than a 60% rate increase. So we know the rate increases are all over the board. We know a lot of that is based on, we've got grandfathered plans, we've got grandmothered plans, and we've got Affordable Care Act plans. So we know that there's the renewals that are coming out are all over the board. But that's what the detail, digging into one of these benchmark studies is going to help give you a little more clarity for each one of your clients. And again, I think it's something that you would schedule a meeting to review with them and really show the value. While I'm mentioning this, I want to make sure that you also are taking advantage of KHI's HR solution. So if you've got your login, great. Make sure that your employer groups that you run through KHI, that you can get them a complimentary login as well. And make sure, if you want to know if they're using it or not, just give Tricia a call in our office, and Tricia can help you determine if your group has been using their login or not. Okay, so that's a little bit there on the employer benefit study. Again, just another way that we're trying to give you a little bit more value and maybe a little bit of an edge over your competition, and obviously to help your client. So the next item on our agenda is really around fall training, and as confusing as everything is, there's so much training going on right now, but I want to make sure, as it relates to healthcare reform, that you know if you're going to play in the marketplace, and remember, this isn't just individual. You can choose individual, you can choose shop, or you can choose both. But you need to go to the Medicare Learning Network website there that you can see up there. This is where the learning space is, to go through. And I got on last night and started going through the slides. And as you guys know, I mean, it's somewhat painful just to go click through, and then they throw you the little tests, the little quizzes, and make sure you're getting all the information. So it is a little time consuming to get through this. I've heard some agents anywhere from 4 to 8 hours, depending on how quickly you can move through. So don't put that off. Again, if you want to play in the shop as well, you need to complete this marketplace training, and you need to do it by the end of this month. You will be shut out, or you're going to miss the open enrollment time frame. So we know that we can always go into the exchange, both individual and shop, anytime, but in particular, you're going to miss this window because the government, your certification, if you did it last year, expires September 30th of this year. So you need to get it done by September 30th to take you from October 1 all the way into 2015. So that's the marketplace training. The next set of training events, as you are well aware, I believe, is fall training. Now, I want to make a mention that I don't have Coventry listed on the slide here because I don't have the information on Coventry. So as soon as I get that, I will let you know. A lot of times they will offer online training, and it tends to be a little bit closer to when we actually have the open enrollment. As you know, in the individual market, open enrollment starts November 15th and runs through February 15th. So it'll probably, I'm going to guess, into October maybe, and we'll be looking at online, but I've also heard Coventry may be doing some face-to-face training as well. So just know that that's another carrier that we represent for you that will be communicating training options. For right now, as you know, we've got Wellmark and Co-Opportunity, and we have at KHI completed 4 of our sessions so far, 2 in Fort Dodge, 1 in Storm Lake, 1 in Des Moines. And then we'll be at in Coralville on Monday and in Waterloo on Tuesday. And then that wraps up our sessions. And just as a reminder, they're from 9 to 4. There's 6 CECs, 5 general and 1 ethics. And the beautiful thing is there's only 2 sign-in sheets. So you come from 9 until about 2:30 or 3, and then depends on how quickly the day moves. And we've been maybe getting out a little bit early as we don't take quite as many breaks. So. Then the Wellmark General Sessions, if you know of, you've got employees in your agency that you really want to go to these sessions and you couldn't afford to be out of the office. I didn't list all their locations, but it just came out yesterday in the Wellmark Blue Briefing. And KHI, as we like to do, pull that out of the Blue Briefing that you may not look at or have time to look through, and we'll push that out, and the subject will be Wellmark General Sessions. So for anybody that missed it, like I said, or if you've got more people in your office to send, they are all over the state. But these are the dates. They're in October, so you can look for those. And then Co-Opportunity Health did something a little different than our Wellmark counterpart there, and that is that on October 8th, Fort Dodge is hosting the morning session, and then Co-Opportunity will do a general session in the afternoon. They're doing this for all of the general agencies for Co-Opportunity. So you'll notice that September 25th is in Coralville. That would be hosted by Mutual Med in the morning, and then it'll be a general session in the afternoon. Now, it's Brown Deer Golf and Country Club in Coralville, and then on October 7th in West Des Moines, that one is hosted in the morning by GBL, and in the afternoon then it will be a general session. So you're not expected to go and drive all the way to Fort Dodge to get your Co-Opportunity training. You can go to any session that you want. Just do what's best to accommodate you. But Co-Opportunity Health is providing these sessions, and just know, and I'm sure we'll have some folks maybe in the morning that aren't with Fort Dodge. They might be with Mutual Med or with GBL, and we're fine with that. This is a KHI sponsored with Co-Opportunity Health, but really Co-Opportunity Health is paying for everything. So we're fine to accommodate anybody if it works for them. But I think Co-Opportunity has made it really clear these are not to be recruiting events. So hopefully if you attend another one, you shouldn't be recruited or feel like somebody's going to try to get you to bring your business over. But anyway, I just wanted to make sure that you knew that's a little bit different. So the morning and afternoon sessions for one CEC, and you must RSVP. We've got the links for you. We pushed that out in one of our news briefs. But and remember, too, if you ever need to get more information on anything that we've sent out in an email, when you log on to khiagents.com, and you can click on News, and then it'll be the most current thing we sent out will be on the top, and you can page through that way, or you can page through by the month it might have gone out, or you can page through by the topic or carrier. So you'll find a really robust section there of archived emails that we've sent out to you guys. And I'm with you. You don't always have a time or a chance to read them when they come in, but you can always go back and look at them at your convenience. So 9 to 11:30 and 1 to 3:30 for all of the sessions for Co-Opportunity Health across the state. And as far as we know, these are the only sessions that will be offered, so there's 6. And they're saying, they're not saying it's mandatory, but if you don't go to these sessions, you're not going to understand how their plans have changed and what they're looking at for 2015. So if you're serious about Co-Opportunity Health and really wrapping your arms around that in 2015, you really need to attend the training. So here's a little bit on AOR changes. So I'm specifically here really referencing Wellmark because these are the big changes for Wellmark, and so I am going to be a little focused here on Wellmark with this sales tip today. But I'm just throwing this out here because I want to make sure that you have some ideas when you talk to people, whether you're in your Rotary group, whether you're at NAIFA, or whether you're in a chapter, or excuse me, a Chamber of Commerce meeting. When you talk to someone who owns a business or who makes the benefit decisions, make sure you ask them. You know, I just want to tell you this. My niece makes healthcare decisions, and so I just asked her. I was like, I knew she offered benefits. So sometimes they offer. You don't have to ask that question, of course. But how's your current broker working out? You know, what do you say? Are you happy, or how's your current broker working out? Or are they taking good care of you? Are they keeping you current on healthcare reform laws? And I guess it's the healthcare reform law, I should say, but all of the components of the healthcare law. So just a couple of things, like I'm sure they're keeping you, and assume that they are. Assume that they're happy with their current broker, and assume, I trust that they are keeping you abreast of the waiting period changes and the employee notifications that the employer must deliver, right? And you kind of shaking your head. I'm sure they're telling you about this, right? I'm sure they've shared with you this. It's not a new concept, but it's one that's getting a lot of conversation, is defined contribution plans. And I'm sure they're talking to you about defined contribution options. I'm sure they're also talking with you about tax ramifications, of whether you just increase their pay and ask them to go get their own insurance, or whether you want to offer it. I'm sure they're talking to you about online enrollment if you're not doing that today, right? And so what you're hoping is you're going to pique their interest on something that they don't know anything about, and they're going to go, tell me a little bit more about that. And now's the time for you to show your expertise. And that's what I hope you've realized now as we come almost 2 years later from us really hitting this hard and trying to communicate with you guys, providing these monthly updates, being out in the field, doing seminars with you. All the things that we're doing is to make you the expert on this so that you have that credibility in front of your clients. And another angle is, are your employees happy? Do you think your employees are happy with the benefits that your firm is offering them? See, that's just another angle to it, because if we're not talking to them about employee retention and employee attraction, right, top talent, there it is. The next question, are your benefits accomplishing what you intend that they accomplish? That is, right, attracting and retaining good people. And I don't know about you, but at KHI, inside of my agency, I'm looking at that. I'm looking at, I've got to keep my people happy because they keep you happy. And so I need to continue to invest in them and make good decisions on behalf of the benefits I offer them. And as you guys maybe heard me tell if you're at our training yesterday, but KHI recently offered the Employee Assistance Program to all of our employees and their family members, which is a huge benefit when you've got employees that might be going through death in their family, a divorce, issues with teenagers, right? Maybe not even teenagers, they're just other children in their family. They're just, how about families that are yours, mine, and ours, or yours and mine, combined families? There are issues out here, and our employees come to work with their issues. And if we can be helpful for them, we bought the package. It's so reasonable, and we have now a general agency agreement with Employee and Family Resources right out of Des Moines. And they're a nation, I mean, they're here in Des Moines, but they sell nationwide, and they offer these counseling services, I mean, a plethora of services. So if you got your brochure from training or your little flyer there, please take another look at it. I know a lot of that stuff gets stuck in a corner and say, I'll look at it sometime. But even ask them, how are you doing with employee retention? And that's another great question. You're not even going to probe about benefits yet. But and especially if you've got an employee and you can say, wow, you know, finding good people is hard. How are you guys doing with retention of your employees? And see how that ties in with benefits. So as we keep all these things in mind, Wellmark then, and I want to make sure you're aware of the time frame. So if you submit your AOR, Agent of Record Change Form, by the 10th of the month for a first of the following month effective date, that works. And the reason they bumped it up to the 10th, I think it used to be the 20th, but they bumped it up to the 10th because in that letter, they will send to the opposing agent and the client and you, and make sure that they know that they've got a 10-day rescind period. And they say it has been approved. And you've got 10 days, so that if that other agent doesn't know what's going on and all of a sudden here comes an AOR, they've got a chance to go in and visit with that employer group. So just make sure that you know you've got to submit it by the 10th, and we encourage you guys to get these to our office. Let us get these in for you so we can track them for you, and we make sure we get them in by the 10th. And then we'll be in the loop, too, of what's going on. So, and the other thing is I think sometimes employer groups, like customers, think that this means they have to change their health plan. Make sure you let them know, I can begin to service your current health insurance plan. We don't have to start, you know, looking around again and changing. I know that a lot of them think that because they've said, I really want to leave the plan we have. I don't want to make any changes to the plan. No worries. You simply, your employees won't know a thing. You simply now are calling me for service, right? That's what you tell them. So here's a couple of tips there. And I want to carry over these AOR changes into our individual market because we've always had group AOR, but now Wellmark is opening up, effective January 1, individual market agent of record changes. Now let's just make sure that you know we want to couch this with this is not the opportunity for an agent to go out and steal somebody else's block of business. Send form letters to all your clients and get them to sign over and say something like, you're no longer in the business. And I've seen this in the market. Obviously, that will not be tolerated. If those get submitted or if Wellmark sees a bunch of them come in all at once, they will research this. I mean, and they've in fact said with these individual AORs, depending on the reason and why the client wants to move, they may call the client. Wellmark will call them and say, what do you want to do? The question came up in our training yesterday, what if two AORs come in at the same time? You can count on it, Wellmark's going to call the client. And KHI supports this philosophy because the client, if we are truly a client-centric business, as I know you all are, and that's why we're aligned, and that's, I believe, why we do business together. If we're focused on the client, it's the client's decision, not yours, not mine, not another agent. It's up to the client. And a client may sign something because they feel pressured, because they feel like it's what they're supposed to do. And when they truly get asked, is this really what you want to do, they may change their mind without feeling the pressure. So anyway, I think we're all on the same page on this, but make sure that that we're doing this all above board in the way it's intended. And so let's look at a couple of the ways that this is intended. You're meeting with your Medicare Part D client, and they don't have their supplement with you. Why wouldn't you ask them to consolidate? Because we know that the supplement doesn't take a lot of service, but a lot of agents, their angle was, I'm not going to get certified on Part D, and I'm going to just take the med sub. And so the Part D gets hung out to dry, and they tell the client, well, you can just do that on your own. Or they leave it with another agency or agent to handle, or they tell them to go to a local pharmacy or something. So if you have that situation, now's the time. Select that agent of record change. We can't submit them until January 1, and what we're asking you to do is just send them in. Don't date them. Send them in, and we'll send them in for you. If they get sent in on January 2nd, which would be the first time that we'll send them in, January 1st, of course, we'll all be probably watching football or doing something relaxing. But on January 2nd, if these get sent in, they will have a February 1st effective date. Because remember, we go back to if they're submitted by the 10th of the month, then it'll be the 1st of the month following. And still give them their 10-day rescind. So that's an angle. And then, you know, also, a lot of you folks have other products. You've got life insurance. You've got car insurance or homeowners insurance. You've got investments. When you're visiting with them, ask them if they'd like you to consolidate their health business. They'd like to consolidate the health business with you, their agent. You've got so many other things of theirs. Would that be helpful to them? And if it is helpful to them and they would like that, then they're going to do it, right? But you need to ask them. And remember, they couldn't change for years and years and years on the individual side. I want to comment as well here that even the direct Wellmark business and Farm Bureau, especially on the Med Sups where it's the same product, or if it's an Affordable Care Act Farm Bureau product that is the same Affordable Care Act product we have, those are really simple, and Wellmark will allow those agent of record changes now, and they never allowed those before. So the point really is, you know, reach out to your clients before someone else does. If you don't have a campaign on how you're going to reach them, you want to please let us know. We've got a letter that would go out to our Part D clients, keeping in touch with them. We've got that letter template. We're glad to share it with you. Call the office and let us know that you would like the copy of the Medicare Part D letter that KHI has put together for you. And secondly, we are waiting on a letter that will go out to under 65, a letter template to give to you to go to your under 65 clients. We'll have that out to you very, very soon, because the other commitment that Wellmark has is they will be sending out a list to us, and we will send to you of all of your under 65 clients. This is the critical, we believe, critical base of clients that need to be talked to. We realize that not every agent last year got their list, or maybe they got it but didn't do anything with it. So you might have some what I'll call low-hanging fruit, a client that is still on a basic and standard or is still on an old plan, and the rates are outrageous. So you'll get this list from us. We'll get you a copy of a letter template if you'd rather send a letter, or hire an intern or find a family member or someone that you can pay to make some phone calls on your behalf out to your clients to let them know that we're interested in making sure that they're getting the best possible value for their health care dollar. And it doesn't hurt. Let's do a quote for a new Affordable Care Act plan. So that's what we're encouraging you to do. Wellmark's encouraging you to do that. And I guess we said it all. It's all about relationships and service and being educated and committed to this market. We're going to find that a lot of people are not committing to this market space. They don't want to get contracted, or I should say get certified. They don't want to mess with the marketplace. And don't forget, one other thing I think that Wellmark's done here, and that's why this time is so critical, is there are many agents that are getting out of the business because, as you know, with their Wellmark appointments, many agents, that's all they had was a Wellmark appointment. Wellmark is saying, we don't want to have everybody across the state with a Wellmark appointment if they're not going to sell. So they're going to be implementing some minimum production requirements or minimum book sizes. They just don't want people out there with 1 or 2 policies. Like what, you wrote your own and then that was it, and you got appointed to do that? What, so you can get paid on your policy? I mean, if that's the only thing they did it for, Wellmark is going to be terminating those appointments. We are going to facilitate that process. We're going to be reaching out to you to make sure if you're one of those, but most likely you're not on the call, because the people that tend to join these calls are the people committed. So you might want to find those people in your communities that have said, I'm not going to do it. So when you see them at chamber events, it might be your competitor, but ask them, hey, are you jumping in or are you jumping out of this market? And maybe there's an opportunity for you to, quote unquote, I'll say, buy their block. You can give them money for that. You can. Some of them only have a few policies. Take them out to dinner, get them a gift card, or if it's enough of a book, we'll facilitate a split with you, and we'll pay them for you. Maybe you want to just say, hey, I'll split what you have, and I'll service it, and you'll get an ongoing trail. I mean, any of that stuff. So let us know. We're open to help you, because right now, you guys, is such a great opportunity for those agents that are committing to this market You're probably getting tired of hearing me say that because I think I've said it now for 2 years, but it's still true. So, so that's about the AOR changes. Get the forms in, get them to KHI so we can track them. It's just all about doing the right thing for the client. And if a Wellmark calls your client on an AOR that they get because they're not sure why they're moving to you, and they talk to that client, and the client says, no, I want to do business with Jane. That's who I have my other stuff with, and I want to consolidate. Good enough. I mean, that's what we need. And that, again, has never happened before in the individual market. So great thing. Great thing. Make sure, too, I just want to jump back on the med subs. Huge opportunity to reevaluate the subs because they may be paying a lot of money. As you know, there's some supplements that are, over $200 a month when you get up there in the late 70s and early 80s. And there's other carriers out there that have really aggressive rates if folks are healthy. So that's a great time to make sure that, you're taking care of them. So I just wanted to make sure I brought that up. Or take them from the old Wellmark plans to the new plans just by answering the health questions. But it's crazy that some people haven't gotten their clients to preferred rates yet. It's crazy. So, all right, huge opportunity out there, huge opportunity. So with that, let me check the time here. I've got 20 minutes until 10. There I am. Okay. Okay, that's awkward, but give me feedback on whether or not you think that's valuable to that adds anything to the call that you can see me. I'm really here. So let's do any questions that you might have and or raise your hand. And I'll look here at the group and see if we have any of that. And thank you guys while I'm scrolling here. Thank you for attending. I can see who's on the call. And what this says to me is you are committed to this marketplace and you do take the time to educate yourself, to stay current on what's going on with healthcare reform. So, so good job. Just a pat on the back to you guys. Kind of looking through here, see if we have any hands raised or any chat. Let's see. Good. I've got some questions here. Let me open this up. So we've got, oh, good information on the shop. Great. I'm glad. And Sherry, nice information today. Was glad to see the question box here this morning. I've not been on for a while. You bet. Let me just open this up a little bit further. And then let's see. Here we go. Paul says, I asked a question yesterday about AORing a Farm Bureau grandfathered policy, and Wellmark said that it would be rewritten to a new ACA plan. Yeah, so think about this. If it's a grandfathered Farm Bureau plan, that means it's not like anything else that we offer. If you recall, Farm Bureau's individual plans were really unique to Farm Bureau. So if somebody had that plan, but if you guys recall, I suppose it was a year ago, Wellmark told us, even if you rewrite that Farm Bureau plan to a new ACA plan on the, I'll call the independent market side with us, they weren't going to change the agent of record, and that just didn't make sense. But I can see that Farm Bureau agent could potentially still support it because Farm Bureau then offered Wellmark's plans as well on the ACA plan. So they didn't have their own unique. I think they still have a few unique ACA plans, but if you were writing them, most likely they could service and support our plan as well. So, so they would have to be rewritten. But what I understand now is you would rewrite them to a new Affordable Care Act plan. Now remember, we're going to quote it out. It may not be in their best interest. And they may need to stay with their grandfather plan. And if that's the case, we can't AOR that because we can't support Farm Bureau plans, right? So you still need to do the math on it and see if the quote makes sense for them to move. And at that point, they will authorize the agent of record change to a new ACA plan from Farm Bureau. Let's see if I got this here. Yeah, I got that one. So I got your question there, Paul, twice, I think. Okay, so got it. Hopefully I answered that, and if not, just reply back. Another question here is, I received an email that my FFM Part 2 is incomplete. Can someone at KHI help me through this process? Absolutely, Marcia. Let me tell you guys, we're all human, right? And I made a big mistake last year. And when I was signing up somehow, and I can't believe I did this, right? But I was typing in my NPN number, and instead of typing my first 3 digits or 751, it went 757. I didn't realize it until, guess what? I completely tested out, and I was trying to do Part 2, and this is where they validate I am who I say I am. And it wasn't reconciling. And it's because that wasn't my right NPN number, and I finally realized that. I had to go back in. You can go to your, go to the profile, under Part 1 there when you're logged in, and change my NPN number. I can change my address. Then I changed my NPN number, and then I had to go back through and retake the test again because I had tested out under the wrong NPN number. So you need to please, before you go to Part 2, go into your profile on your learning page and make sure that everything is correct, especially your NPN number. And then when you go to Part 2, just give our folks a holler. Lindsay, Janice, Carol, they're all in the individual teams. They're all helping agents work through this right now. Just give them a shout, and they'll help you through that second phase. But that's all around validating who you are, and your NPN number is critical. So let's see. Here we got from Tanya. Lynn, you do a great job in offering suggestions on what to say to new clients, but I wasn't able to write them all down. Could you create a list of open-ended questions and post on the KHI website? Absolutely. In fact, I hope you guys, I want you guys to know that every single one of these conference calls is recorded, and the PowerPoint slides are posted on our website. So when you log into KHI Agents, and I know there's been a little trouble, and I'm not sure why, so we had our website guide. A couple of you guys had trouble. We're going to get that fixed. Well, I know there's browser issues. Some browsers work better with some websites than others. So anyway, if you're having trouble logging into the KHIagents.com website, let us know. Otherwise, you just click on, I think it's slides, if I remember right. I'm going to go there real quick onto that. Let me see if I can get here. I'm going to go to the page. We'll take a quick peek at it. Okay, so you should be able to, hopefully you see my screen there. And when you click here under, there it is, when you go to resources and you go to videos, so you can look at videos, and if I clicked on that one, and I will here real quick, it will bring up for you, see all the past, you'll actually hear me go through these. So you'll get full audio, and we go through, and you've got all my explanation. If all you want to see are the slides because you just want those open-ended questions, then when you go to resources up here, and instead of clicking on videos, slide over and click the slide button, and then you'll just see, hopefully you guys can see all that, you'll see all the different dates and all the slide presentations. And then you can, it says print, but just open it, just click the print button, it'll open the presentation, and then you'll have that. And I'm sure it's in PDF or whatever, okay? All right, let me bring this little question pane back up here. Let's see. And then it looks like Donna has a question on the MLN, that's that Medicare Learning Network. I was certified last year, so do we still need to do Part 2? I thought I saw an email that we don't. And you're exactly right. We're gonna go right. We should be able to go right through that process. But guess what? I probably would have gotten hung up again had I not gone back and changed my NPN number. So so you should be able to sail right through, but it'll walk you through that. If you have any questions or you're trying to work through it, just give our staff a holler, and we'll help you through it. Now here's just another little help maybe. Sherry says, I've noticed that if I have Internet Explorer 11, I can't get into the agents portal. So I log in with Firefox, and it lets me in. So thank you so much, Sherry, for that FYI. And also she says I had the FFM error too, like a prior caller, and I sent an email to FFM, and they sent me a corrected email that I am okay on the training. So just another thank you so much. That's what this is so good for, is just more sharing from you guys, so we see we can learn from someone else's issues and errors. So thank you. Thank you for that. And I'm going to go ahead, and Paul, I see your hands up, so I'm going to try to unmute your microphone. And you might be against there, I guess. Are you there, Paul?
Yeah, I'm there. I actually don't need anything. You answered my question earlier. Thank you.
Okay, you bet. No worries. Okay, let's see if there's any other questions that you guys have. These are awesome. Thank you so much, you guys. I don't know, I love these, so I hope you guys do. I'm going to keep doing these because I'm going to continue to enhance them. Like I said, adding sales tips and trying to make them just a little bit more valuable for you. If you can give me this 1 hour, I appreciate that so much. So does all of our staff, actually. Okay, see if there's any other questions. Let's see, I'm not seeing any. And yeah, so there's the news I was telling you, our calendar of events as well. Don't forget about our Grow Your Business incentive. So I know we haven't sent that flyer out for a while. We have a little transition in who is actually pulling the report. So we'll be sending an update out real soon about how all of you are doing with the Grow Your Business Award. That's for our award dinner that we do in February based on the prior year and your production through KHI. So we'll be getting that out to you real soon here and announcing that. I don't see any other questions, and I'll scroll down one more time through and see if I see any other hands raised. And not seeing any more here. But if there's no more questions, again, feel free to email me or text me, 515-570-8811. I think you guys know my mobile number, but text me if you have any other questions or any other topics you'd like to see me have. And maybe what I could do, I'm going to throw out an idea here. So this is really crazy. Before we go, I think I was working on this presentation last night, and I just had this crazy idea. Look at the video. Now, I intentionally put myself up there on video today, and I don't know that that's of value at all, but I want to tell you this, that I know, because I will click on a video link, right? So if somebody sends me an email and there's a video link, maybe instead of reading, I might click the video link. And so I'm thinking, what if I did, maybe once a month, I capture all the emails that we send out to you guys that I think are important, and I do it kind of like rapid fire. Have you seen the monthly or the weekly news or the daily news, and they'll do around the world in 60 seconds? Okay, it's maybe a little bit on that. I was kind of a Glee fan, and I remember seeing on the show Glee, here's what you missed on Glee. And that was literally what popped into my head. They go, blah, 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 and these are all the things, and that's what you missed. And so I thought about, what about a KHI, blah, 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 blah. Now, I would talk slow enough so you could hear me, but I would go very quickly, and then, of course, I would probably post these so somebody could pull it down. Or we'd say, everything I just told you is on our website, either under news or under our carrier links, right? So that way, if you miss our email throughout the month, if I fire you a video and you listen to me, versus having to read it. So if you have thoughts on that in the last 8 minutes that we have approximately, I would be open. And thank you, Frank. I see your good morning, and agree that we need to keep these monthly calls and keep you up to date on the topic. You are so welcome. Paul says, you like having me on video. Thank you, Paul. I'm not looking at myself. That's how awkward it is. I'm looking at the screen, because to look at myself is weird. So if you have any other thoughts that you want to share about anything, or that idea I have about the video, and again, you can click on it or not, right? But there's another thought. Your idea on the Around the World in 60 Seconds is excellent. Okay, because I think then my thought would be, here I go. Kate, Aetna just had a rate increase. Blue Cross just sent out a new application. Whatever it is, right? It would just be these bullets, these little things that would say, this is what you need to know. And if you need more, it's not on the video, you're going to get it. You're going to contact somebody in our office. You're going to check our website, right? So, okay. Excellent. Thank you, Marcia, for that feedback idea on the video. Okay. I think, you guys, video is going to continue to be, Brenda, thank you for your feedback. Video, great idea. I think we're going to see video. Now, I want to make sure you guys know this, that video, we're starting out right now with testimonials. And so thank you for those agents that have volunteered to do a testimonial for us. If you're willing to volunteer to do a testimonial for KHI, we want to have this on our website. We know that recruiting for agents is typically with Wellmark a once-a-year type of a deal. But we also know that there are other agencies out there like KHI that say to their people, if you're not happy, you can leave at any time. And KHI has that commitment. We hope you don't, but we have that commitment because we think it's the right thing to do. It causes me to come up with crazy ideas, right? Continue to doing the things that we think bring value to you. That's part of our value proposition. We kind of think that why wouldn't we continue to provide testimonials and recruit all year round? So people continue to see the work that we do here at KHI and might be drawn to us, if not sooner than later, right? So if you're interested in doing a testimonial for us, let us know. But here's where this idea came from. I have a gal, she's out of Des Moines. Her name's Erica Kiefer. She's amazing. Her passion is video and editing and websites and new technology. Oh, and by the way, she's a lot younger than I am, right? She gets all this stuff. And when she starts to tell me about this, she's like, Lynn, people will click on a video before they'll read how great KHI is, blah, 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 right? So that's why we're doing these video testimonials. But what about other kinds of videos? You guys remember a while ago, Laura Jackson recorded a video, and she sent it out to all the agents. I'm like, are you kidding me? I'll bet her open rate. Oh, and by the way, you can check the open rate, right, on how many people actually clicked and opened the video. Like, how powerful is that? Kind of like you can do on, did you open my email, but I don't know, did you open it and not read it? But how many people actually did the video? I remember that because I wanted to hear Laura tell me whatever she was telling me. And you think about the message she's trying to get across. If she can do it, and we can see the expression on her face, the tone in her voice, the look in her eyes, right, that we know she's sincere and authentic, and that's what we're all about. I'm thinking we need to use video more, right? So why not you guys? When we find out something that we think might work for us, why not you guys? So how about you trying to attract people? Hey, do you have a website? You should. If you don't, get with us. We have a program to help you. If you have your website, do you have videos uploaded on your website? Let me connect you to Erica. She's doing a deal for us, and she'll do, I forget what the initial cost is for just one or two, but we just signed an agreement with her to do 10 testimonials for $2,500. You guys, that's $250 a video. Now, that might be a smaller number because we committed to doing 10. But see how many you want to commit to. But if you would like Erica's contact information, get to me on that, because I don't think I've pushed that out to our staff yet. If you're interested, please send me an email. I will send you her contact information. Think about how you can continue to make a difference in your community with all your products and services, not even healthcare, right? How powerful is it if you had somebody in your community talk about what a great thing you did? And we know it's all a great idea, but who's going to execute it? I'm telling you, Erica has the camera. She can do that. And what she would do with us, she taught us how to run the camera, and we set it up and got them. So it's a lot cheaper and more cost-effective, I should say, if we can get the recording done and then send the video back to her, send her camera back to her, and she does all the editing. So it's easy to do. It's not so hard and crazy out there. So here's a couple more. Donna, thank you for the idea of a video. It is easier to listen than to read, especially you can even multitask, right? You think you're checking emails and click on a video while you're doing something else, and you can at least hear it. So here's where can we find the well-marked training dates? Yeah, those general session dates, they just came out yesterday in the Blue Briefing. And I have the email of them, but Kathy said they're in the Blue Briefing. And what I've just asked my staff to do is turn that around and send them out. I was going to kind of wait until we were done with our 2 sessions on Monday and Tuesday and then say, hey, if you missed the well-marked training, well, we will be sending that out. If you need it sooner than that, just check your Blue Briefing or holler at someone in our office, and we'll pull the briefing for you and send you the date. Okay. All right. Any other questions? Comments? I don't know. I just love what I do. I love you guys. I love what I do. I love helping our clients. And so thank you for, again, I know it's cheesy, but anyway, thanks for allowing us to serve you, because it is what fires me up every day. It's why I get out of bed. So, okay. With that, you know what, you guys, 9:58. I think we did pretty good. I will let you go. Have a wonderful weekend and a great day. Stay dry. And, ooh, stay warm. Now it seems all of a sudden fall's here. So take care. We'll be in touch. Shoot me emails. And we'll look forward to hearing you and seeing you again next month, if not sooner. And thank you. Everybody else, have a wonderful day and a wonderful weekend. Bye-bye.